When I first came to Kehewin, we strictly had paper charts. I was the nurse in charge here from 2006 until 2013. So as the community health nurse, I did immunizations for the community, and then that continued in my nurse in charge role. We had a lot of kids in care that would be with foster parents who didn't necessarily know all of their history. The big challenge with that was sometimes we didn't give any immunizations because we didn't know what immunizations they did or didn't have. And then in other times when the kids would be here in the community for a longer period of time, we would decide to start their immunization series from the beginning because we had no records, and then we would find out that we just in fact double immunized them. So that was a huge challenge for those kiddos.
I think the problem that we really had was record keeping. Trying our best to keep the records, and sometimes like the high needs patients would have multiple records, and whether it be the public health forms or it's the home care forms under the home care program. So then you got to get in, you got to get the forms. I have clients where I currently have to go through their records right now, and I have to pull old data from years ago. You do have to sit through there and you have to sift through all the information, and you don't know if it's going to be in the front page of the chart or the middle or at the back page of the chart. So there's a lot of work when we have to pull those charts to look for old information.
CHIP is an electronic medical record that was developed so that we could record kids' immunization records and share that.
CHIP, currently I'm using it for essentially all the forms. We can find a lot of the information for day-to-day nursing in one entire system.
Having an electronic medical record for immunizations is huge, so that if you're in Saddle Lake or Kehewin or Frog Lake or in Bonnyville, that information is shared in real time. It made a huge difference while I was working here, and it continues to make a difference being a partner, because it was a huge gap. And now with electronic health records and My Health Alberta, anybody can see their own immunizations and know what they've had or haven't had, and you carry that for the rest of your life.